Our next guest is a longtime SHPNA resident and tireless advocate, Santa Clara County Board of Supervisors President Susan Ellenberg. Welcome, Susan.
Good morning, everybody. Thank you so much, Ed, as always, for the invitation. And my husband was home during that walk with Kana around the neighborhood and was like, I think our congressman is just walking in front of our house. So that was
we pointed and
the
that is
moment.
where the Supervisor Ellenberg lives, and we keep it with you. So
I love that. Thank you. And I see that my colleague, Supervisor Chavez, is here as well. So yay,
yes.
welcome to a D4 event. Um, I am serving my second year, just starting my second year as the board president. And last, 2 weeks ago already, I presented my State of the County, which is an opportunity for the board president to take a look back at the previous year, a look forward. The theme this year is building safe communities. And I wanted to really drive the point home that nearly every department in our county works in pursuit or in furtherance of community safety in some way. So I'm not going to redo that presentation, but Victor is going to pop a link to the State of the County into the chat. So if you missed it, I encourage you to watch it. There's lots of fun stuff there, including everyone in the chambers, except perhaps Supervisor Semidian, singing along to the Muppets Rainbow Connection song. So that's just a little teaser. But what I'm going to do this morning is what I've done every year for this group, which is present a look back at 2023. And I'm going to highlight 4 particular policy areas. Of course, my work in furtherance of my children's agenda, mental health, again, safer communities through criminal justice reform, and our housing progress. So let's get going with that. Next slide, please, Victor. Or Ed, whoever's doing the things. Thank you. So some of the biggest news around the children's agenda has been in the way that we've responded to the childcare crisis, which is not a new crisis, but really was magnified during the pandemic with hundreds of facilities that closed down and were unable to reopen. So we were able to use some ARPA dollars, that's from the American Rescue Plan Act, one-time dollars to create a couple of different grant programs. The first is $15 million to reopen childcare facilities that closed during the pandemic, renovate, expand, or improve current facilities, or use as seed money for new facilities. We opened that application period and within 48 hours got requests for 3 times the amount of funding that we had. So $15 million felt like a lot. We certainly could meet that need many times over. We also put $10 million into another program to create paid apprenticeship programs. And we're working with First 5 Santa Clara County and Mission College to provide those apprenticeships to add to the childcare workforce. Again, that's work that needs to be ongoing, but this grant helped to jumpstart that. Next slide, please. The Office of Children's and Families Policy, which Supervisor Chavez and I led to create a couple of years ago, is now in full force, working on the childcare expansion, working to expand our county's youth voice through the Youth Task Force and really getting them involved in policies that impact them. I led the creation several years ago of a children's budget, which essentially pulls from our $11 billion budget all of the work that we're doing that touches children. The next step that I'm going to be working on is truly to operationalize that budget to make sure that we're not just aware of the funding, but we are measuring its impact, redirecting as necessary, and really working to improve outcomes for children, which literally, as you've heard from me, improves outcomes for our whole community. We've invested $10 million from the county, $2 million from our probation department, and another $1 million in private funds to support grants to create wellness centers at our schools to be able to better meet student health needs. We've learned that kids are 21 times more likely to access mental health services if their first touch with them is through their school. So I'm very proud of that work as well. Next slide, please. Black infant health has been an area that I have also really deeply focused on since 2020. We've extended funding to our public health department to work on this. We're growing our perinatal equity initiative work. We did our first conference last year, attracted 700 people from around the country. We are building on that work, and we have a partnership with our Bay Area hospitals to coordinate work to improve outcomes for Black pregnant people and infants across our county. Next slide, please. Second area that I said I would talk about is mental health. You may remember that in 2022, Supervisor Lee and I led our colleagues in declaring mental illness and substance use disorders a public health crisis. And we did that in order to vault that issue really to the top of the county priority level, to let our executive know that this is where we want you to be spending most of your time. And since that time, which actually, we kind of predated all of the state work around mental health by several months. But this is what we've accomplished in the last year. We broke ground on the 77 inpatient psych facility. We've contracted with a private provider for 53 additional beds. We've in total added 131 beds since January of 2022. We are working on workforce development. We know that we're not up to where we need to be yet, but we are moving in government terms, really at quite a fast clip. Next slide. One of the biggest changes that you'll see coming with Proposition 1, with SB 43, and with a lot of elevated attention around substance use disorder really finally being recognized as a disease and a component of mental health, as opposed to, a separate kind of behavioral choice category, means that we need to really expand the resources and the capacity that we have to meet people's needs. So we are doing this through our reentry program, through adding beds for youth, adding beds for moms with infants. We have created, but we didn't create, the federal government created a 988 crisis hotline, but we have expanded our offerings with mobile crisis support with and without law enforcement, and a real focus internally and externally on how we do a better job, both preventing addictions and then focusing on education, harm reduction, and treatment. Next slide. Third area is criminal justice reform. This has been a priority for me really since I joined the board, because in my own learning and growing into this job, I see so much of what we do that we think makes communities safer, not really having the impact that we want. So I am looking for ways that we can, number one, provide early intervention, prevention services, diversions from jail whenever that is possible, particularly when the underlying motivator or cause of harmful behavior is a mental illness or a substance use disorder, trying to avoid getting people into the system. When it's unavoidable and they're there, I think it's incumbent on us to make sure that we are doing everything we can to help prepare people for a more successful reentry. And our college collaborative program that's led by the Sheriff's Office has been an incredibly exciting piece. We've seen people go from in custody, beginning that college collaborative program, smoothly matriculating at community college when they come out of custody, and we've already had our first graduates from that, so very exciting. Next slide. I am not going to read all of these things, but what I will say is that we are looking always for investments that we can make to be able to expand our services. And I'll highlight the one at the bottom because it was $500,000 that State Senator Aisha Wahab was able to direct to our county, to our faith-based reentry resource centers, specifically to focus on meeting the needs of kids whose parents are incarcerated, to try to break those cycles. Next slide. Measure A. Mayor Mahan mentioned that briefly, and what I want to remind everybody of is early on, when this measure was first passed, and again, I'm going to credit both Supervisor Chavez and now Senator Cortese for leading on that measure. People said it's too expensive. It's too expensive per door. It takes too long. We can't invest in permanent supportive housing that way. We do have to do things cheaper and quicker. And I'll tell you that since we started in 2016, obviously the rollout was slow because we needed to get projects in the pipeline, but we are moving. We have allocated all $950 million of that Measure A bond, and we are ahead of schedule in spending the money, and we have over delivered what we had promised in terms of units. Let me take a subset of that, and then I'll go bigger. Heading Home was a sub campaign under Measure A that focused specifically on families with infants and toddlers and pregnant people. In the last 24 months, we have housed over 1,400 families through this program. We've served another almost 2,000 through our county's homelessness prevention system, which has been validated by MIT and reported by the University of Notre Dame to be statistically significant in preventing homelessness. So you'll hear a lot more about this year. Measure A, actually it's now 11 cities. Campbell has a project now. We have Measure A dollars have helped to fund over 5,000 new apartments, nearly 700 renovation units, 56 housing developments. This has worked. Next slide. These are new developments just in this past year. So again, this works. From a public policy perspective, there have been few measures that have been as effective and as well used as Measure A. The challenge that we are facing is, as much as we have over-delivered, produced units, done so in a way that is sustainable, ongoing, people are still losing their homes faster than we're getting them in. So what we absolutely have to be deepening our focus on is how we prevent people from losing housing in the first place, because we can't build endlessly. Next slide. A couple of additional projects that have been built with or opened with Home Key, with federal funds, Home Key funds. Sorry, those are state Home Key funds, federal HUD funds. We are literally looking for money under every stone. Our administrative staff is very good at finding money, and we're using it to build, renovate, open, and house people. Next slide. Just some fun stuff that I wanted to finish with. One of the things the supervisors get to do is make proclamations at board meetings, and what these do is really just elevate for the public particular issues or populations in our community that frankly warrant attention, either celebration or more work to advance. So these were things that I got to lead on. Next slide. We are all about being in the neighborhood. I know that you all know Victor Santiago from my team, but being in the community, whether it's waving in a parade or sponsoring an event or just showing up, is a great way for me and for my team members to make sure that you know how to easily reach all of us. We do our once a month farmers market sidewalk hours, food for thought. Hopefully, I know that a lot of you have stopped by that in the Rose Garden. We go every month to a different farmers market in District 4, so we get to each market about twice each year. Next slide. These are neighborhood associations that we have been to, and really anytime I'm invited, I am always delighted to show up and provide specific updates on whatever you want to hear about. Next slide. That is it from me. If you have not yet signed up for my newsletter, Victor's popping the link in the chat. Please do that. And Ed, if there's time for questions, I would be delighted to answer them. And if not, I'll make sure you all know how to find me.
Sure. Yeah, actually, we had one question that had originally been posed for the mayor, and it's one of those questions that kind of city, county, how do we interface, how do we deal with this properly, and specifically was involving kind of homelessness and mental illness. So I told the questioner I was going to punt and give you a nice easy softball with that one. or not. I'm 100% in favor of getting the unhoused off the streets and safe, but how will the enforcement work? For some, living unhoused is a choice. How can living indoors be forced upon these individuals without trampling on their rights? It sounds a bit more like incarceration for that subset. That is not the intent, but how do we walk this hard path?
So that was absolutely a question for the mayor because I'm not, I have no intention of seeing county enforcement of that. Right now, and for some people, yes, they don't want to come into housing, but truly about 90% do. So rather than worrying right now about compelling the small percentage of folks who don't want to come in, let's get everybody else housed. For the vast majority that will accept housing and services and support, let's start there. Imagine if we could reduce by 90% already the folks that would be left that I think, we continue to work with, that would be a dramatic change. So let's start with the folks that want this service, and let's keep, I know both the county and the city have outreach workers in the community building relationships, building trust with people. My hope is that through those relationships, even the most calcitrant will at some point feel trust enough and understand that it may be safer, healthier, better for them to come inside. But I am not interested in a method that promotes enforcement, because truly the only tool that you have is incarceration, which literally makes no sense, doesn't help anybody, is not a long-term solution. It gets somebody off the streets temporarily. And I don't know what enforcement would look like otherwise. Moving somebody out of one camp to another is not solving the problem.
One other question, actually from one of the board members. There's a lot of focus on assisting with childcare, but the other end of the spectrum, senior care, isn't spoken about as much, but needs some attention. Families are often torn apart or bankrupted by the extraordinary cost of care for seniors experiencing dementia-related illnesses, often not covered by insurance. Is there a way to protect the family home so that the next generation doesn't end up homeless while still being able to offer the care our seniors need and the relief families so desperately need? Is there, or could there be a similar program to the childcare, but that addresses the other end of the spectrum?
I love that question. And yes, the care economy at large has to include adult dependent care, care for adults with disabilities, as well as for children. For sure, my focus has been on the childcare piece, but it's actually something most of you or all of you know Steve Klein, who's a policy advisor in my office, and his focus is particularly on the aging adult community, also on the LGBTQ community, but he works with our senior care commission. He attends meetings at the state level. He is very engaged in helping me to develop a more robust policy platform where we make sure that we are thinking about the needs of our older adults. And given the population trends that we're seeing, more and more of our population is going to be over 60. In fact, I think between 2014 and 2024, the population of folks 60 and over is doubling. So and again, I'll just come back to the flip of that. The flip is that young families can't afford to live here. So our population is aging, but we're losing young families. So again, I'll bring that back to childcare as a factor that keeps young families in a community. But yeah, you're going to see more work from my office over the next few years around older adults. So thank you for that.
And then last question here, and we'll let the supervisor go. Is the housing that is being built being equally distributed among the cities in Santa Clara County? I think San Jose is about 50% of the population and among the lower amount of revenue per resident and jobs to housing ratio. Is more or less than 50% of the housing being built in San Jose? Are all cities doing their part, and how can the county help with spreading the task among the cities in the county?
So no, it is not equally distributed because there are so many factors, not only where the homeless population is, and far more than 50% of the county unhoused population is in San Jose. So it's by no means a 50-50. The fact that we have projects now in 11 cities is impressive and significant. The cities that don't have projects, in some cases are because they have pushed back, but there are also some legitimate concerns around lack of access to public transit, the even more exorbitant cost of land from city to city in our county. You know, if you want to compare Milpitas and Los Altos Hills, for example, it's extraordinarily more expensive to build in Los Altos Hills, and the public transit there is almost non-existent. So the spread has to be equitable as opposed to equal. What I would love to see is all cities in the county contributing to housing production, even if it's not in their particular city. Help us build, contribute to units, make sure that we are all sharing in the responsibility for housing our neighbors.
Wonderful. Thank you again, Susan, for attending. We're obviously a long-term neighbor and a long-term advocate for us, so it's always a pleasure to hear from you. And thank you to Victor and your staff. We've been emailing back and forth, coordinating this. We very much appreciate their assistance as well.
Absolutely. Thank you all for the invitation. Have a great day.
Thanks.